Hi, my name's Rosa and I'm from AinsCorp. We distribute salts ostomy products throughout New Zealand and Australia, and today I'm going to discuss stoma care for healthcare professionals. So first of all, what is a stoma? A stoma is the result of a small opening being surgically created on the surface of the abdomen in order to divert the flow of feces or urine. There are three different types, two from the digestive system and one from the urinary system. The digestive system's normal job is to absorb nutrients, water, and salts from food, and the urinary system's job is to remove waste from the blood and dispose of urea. There are three different types of stomas. A colostomy, which is formed by bringing part of the colon or large intestine through to the surface of the abdomen. An ileostomy, which is formed by bringing part of the ileum or small intestine through to the surface of the abdomen. And a urostomy, which is formed by bypassing the bladder, bringing the ureters to join a small resected piece of ileum or small intestine, and that is then brought through to the surface of the abdomen. So urine flows directly from the kidneys through the ureters, through the small piece of small intestine, and then into a pouch. There are many reasons why stomas are formed, and these include colorectal cancer, Crohn's disease, ulcerative colitis, diverticular disease, incontinence, trauma, radiation damage, congenital abnormalities, bladder cancer, and interstitial cystitis. There are many different stoma products and appliances available to ostomates, and what they use is usually dependent on the type of stoma and their output. So a majority of colostomates, so those with a stoma from their large intestine, will use a closed appliance. And this is because their output's likely to be much more formed and solid, as it will have absorbed quite a lot of water from the output through the small intestine, so it comes out much more formed and complete. So they will change this bag 1 to 3 times per day as it fills up. If the output is more liquid, as with an ileostomy, so those with a stoma from their small intestine, they will use a drainable appliance and drain the output as the bag fills up. These can be changed every 3 to 4 days depending on the output. So because they can drain it, they don't need to change it every time it fills up. Drainable pouches must be emptied when they're 1/3 to half full. Otherwise, emptying can cause spillage problems, and this then leads to other issues, not just mess. So we have to empty them when they're 1/3 to half full, not waiting until they're completely full, because that's going to cause issues. The pouches do come in a variety of sizes. You've got mini, standard and large, and they come in these sizes to suit individuals' daily requirements and potentially their output requirements as well. All the pouches do have a filter which aids in expelling gas from the bag. If you think about a normal digestive bowel, puts out about 2 litres of gas a day, and this doesn't change when you've got a stoma. That gas still needs to come out, and the only difference is it's contained in that bag. It doesn't just get released into the air anymore. So sometimes the bags can balloon a little bit, but the filters should help with this. Otherwise, your stomal therapist will have some advice as well. The most important thing is that we need to regularly check the pouches for how full they are, any leakage, ballooning, which is what I just mentioned in terms of gas, and most importantly, are they still sticking correctly to the skin? So now that we've talked about the different types of stomas get different types of pouches, we can then start looking into the different types of pouches or appliances that they might put on. So you have the option either for a 1-piece or a 2-piece appliance, and 1-pieces are, like in the right photo, just completely 1 piece. So you've got your base plate, your hydrocolloid sticky bit, sticks to the skin, and that's attached to the pouch, and the entire base plate and pouch is changed every time you need to change your pouch. You can also have a 2-piece, which you can see in the photo on the left, where your base plate, your hydrocolloid sticky bit, is separate from the pouch, and you can leave the base plate on and simply change the pouch. This system can be quite good because it means you leave your skin intact. So if you're, example, a colostomate and you're changing your bag 3 times a day, it means we're not stressing out that skin around the stoma by taking off a really strong adhesive 3 times a day in the same spot, we can leave that skin intact for 2 to 3 or 4 days, depending on the stoma and the person, and simply just change the pouch as it fills up. So you'd use 1 to 2 pieces depending on your stoma, your lifestyle and your preferences, and the stomal therapist can help advise on this as well. If you've got a 2-piece system, you change your base plate 2 to 3 times a week, and if you have closed pouches, you change them 1 to 3 times a day, as with the 1-piece closed, or if you've got drainable, same as the 1-piece, you change that pouch every 3 to 4 days. So here we can see some examples of different 1-piece and 2-piece appliances. On the left you've got your 1-piece where the base plate and the pouch are all together and you change the whole thing when you change your pouch. Or on the right side you've got your 2-piece where you can see the base plates are down the bottom and they stay attached to the skin, and then you can simply change the pouch when needed. The other type of stoma that we discussed was the urostomy. So urostomy bags fill with urine and have a tap on the bottom of the bag for drainage. These can be changed every 3 to 4 days and can be 1 or 2-piece. And they're simply, if they've got a tap, like with the drainable pouches, you can go to the bathroom and empty them into the toilet and then clean them up and continue wearing them. However, overnight we can't get up all the time when they're full, so they do connect to an overnight drainage bag, and these can simply be rinsed out and used again. So I've mentioned hydrocolloids a couple of times, but this is essentially the sticky bit or the base plate. It's what sticks to your skin, so it's the adhesive wafer that sticks the pouch to the skin around the stoma, and it is the most important feature of that pouch. This is because it's comprised of adhesive and absorptive components that are really especially suited to stoma care. And this is because they absorb discharge really well, so if you get any potential leakage around your stoma, it's not going to hit the skin, it's hopefully going to be absorbed by that hydrocolloid. It protects the skin by doing this. It is really, really strong, and it's hopefully not going to be eaten away by any output that inadvertently gets on there. And they're really gentle and flexible on the skin, so you can wear them, day after day on your skin, and hopefully they're not going to cause any problems. There are many different types of hydrocolloid, and they all just have different compositions and additives depending on the company, the brand, and the design. So we need to be really careful because it is a really strong adhesive. It has to be, because it's sticking that pouch to the skin potentially for quite a few days. So we need to make sure it is strong, but this means we also have to take really, really careful care when we're removing the pouches. So we need to do it slowly and carefully, making sure that we're not causing any damage to the skin as we're doing it. And as I'll mention later, we might even need to use some adhesive removers as well to make sure it comes off without causing any damage. Then we start to look at the different types of hydrocolloids. So we've discussed the different types of pouch, but now we'll discuss the different types of hydrocolloid or wafer. So you've got your flat wafers on the left, which are simply flat, flat base. They look like your normal hydrocolloids that you might have used in other parts of care. And then on the right, you've got your convex wafers. And the difference with flat and convex is that the convex bags are designed to curve in around the stoma. They apply slight pressure on the tissue around the stoma to aid in making a more spouted output into the pouch. So we're potentially not getting any leakage onto the skin around the stoma. We're getting that more of a spout into the actual pouch for collection. There are many different levels of convex, from soft convex to firm, depending on how flush with the skin the stoma is or if it's potentially recessed. We just have to be really careful that if we increase our convexity, we don't cause any pressure damage to the surrounding skin by increasing that level of convexity in there. But again, we need to discuss any changes with a stomal therapist. So every stoma company has an amazing website with plenty of information for both ostomates and health professionals. Like I mentioned, we are AinsCorp and we distribute salts products. So our website, ainscorp.com.au, you can find plenty of patient information and education on there. We've got just general guides for living with your stoma. There's also videos on how to apply the stoma and how to clean them and remove the pouches and things like that. So one of the most important things of caring for a stoma is to know that the skin around the stoma, the peristomal skin, it should look like normal skin. Just because there's a stoma there doesn't mean that skin should look any different. If it doesn't, it could be due to a range of things, including excoriation or irritation, which is caused by a leak. It could be excoriation or irritation caused by an inappropriate product. They might have an allergy or sensitivity to that specific hydrocolloid. It might be an allergy or an irritation, like I mentioned. It might be a mucosal separation of the skin from the stoma. There might be some trauma from pouch removal or from cleaning too harshly or from cleaning products. The pouch might be left in place for too long, or there might be certain diseases or conditions that can make that skin much more prone to irritation. So these are some pretty bad examples of common stoma problems. You've got contact dermatitis. If you've got a stoma in a crease, that can lead to much more things like leakage because it's much harder to get a seal of that hydrocolloid. We've got peristomal hernias, you've got allergies, dusky stoma, ulcers, mucocutaneous separation, and a prolapse. The really, really important thing is that if you have a patient with a dusky stoma, you get medical help for this right away as it can be quite serious. So I'm going to give you a bit of a rundown on how to troubleshoot stomas. So first of all, we need to identify the problem, explore the reasons for that problem, find a solution, and then choose a product. So is it potentially from product sensitivity? We need to consider, does the irritated area mirror the shape of the hydrocolloid or the wafer, or is it from an accessory that might have been used, such as a seal? Is the affected area itchy, red, broken, weeping? What exactly is going on with the skin? Have they changed their appliance or application routine recently? Could that have affected it? Do they have any allergies? Is it potentially an ill-fitting appliance? Have they gained or lost some weight recently or developed a hernia? Have they had other surgeries close to the stoma site and maybe they've got a wound there as well that might be changing how the appliance fits? Has the actual stoma changed shape? Or is there a crease near the stoma site that wasn't there before? Have they had a change in output? Have they changed their diet habits or their food consumed recently? Have they been travelling? Are they having chemo or radiotherapy? Are they on any different medications? And have they actually had a change in colour or the appearance of the output? We also need to look at trauma to the skin or the stoma. Is the hole in the pouch the wrong size for the stoma? Which I'll go into more on the next slide. But is the appliance actually comfortable for the patient, or is it really uncomfortable, indicating that there might be something that could be an easy fix? Are they changing it at the right frequency? Have they increased or decreased the amount that they're changing the bag? Is the skin around the stoma hairy? If there's a lot of hair on there, it's going to be much harder to stick that appliance, and then on removal, it's going to be really painful to take that appliance off, and that's going to irritate the skin as well. Or like I mentioned in the previous slide, is it a dusky stoma? Has it turned dark red or purple and is looking a bit dry, hard or flat? If it is, you need to get this seen to ASAP. So once we've identified the problem, we need to look at solutions. So your best solution is to book an appointment with a stoma nurse. Easy fixes are often just using a gentle, regular changing technique. So being sure not to rip that hydrocolloid off too quickly. If you're using remover sprays, wait 10 seconds for them to work before you actually remove the pouch to make sure they're doing their job and releasing that hydrocolloid adhesive. We need to be aware of the effect of medication or other medical treatments on the skin and the output. We need to check the size of the stoma and the pouch regularly to make sure they're using the best option for their stoma. So the two pictures at the top on the right are the most important pictures. We need to make sure we are cutting the appliance like the top picture. Really, really close, not too close that we're coming into too tight on that stoma, but making sure that there is no skin visible, because if there's skin visible, it's likely to be leaked on, and that's going to then cause irritation problems. We need to be careful of the food and drinks that may affect output if it affects output negatively. So rich or spicy foods can do this. Not for all ostomates though. Some people have no problems and some people know they need to avoid certain foods, otherwise it's going to really affect their output negatively. We might need to also consider using some accessories such as seals or flange extenders to support the appliance, and I'll go into these on the next slide. Like I said again, and I'm going to drill this in, but more serious issues like a dusky stoma, which indicates stomal necrosis or death of stomal tissue, requires immediate medical attention. So as I mentioned, there are many different types of stoma pouches. There are also many different types of accessories, and these can do a myriad of things and include skin protection, leakage, security, deodorant for putting into the bag to potentially help with odour. We've got thickening agents that help thicken up the output if we're worried about the output being really liquid and potentially causing leakage problems, or to make it easier to help with emptying the bag so it doesn't get as messy. And we've got agents that can help with removal as well. But again, the best thing to do before using these is to talk to a stomal therapist who can advise on the best ones and how to use them. So how do we order our pouches in New Zealand? The ostomate must be in contact with a stomal therapy nurse and they will arrange the product for you. We're very lucky in Australia and New Zealand in that we get certain product allowances each month for free provided by the government. We are very lucky. There are many countries that don't have these options and they have to pay for the pouches themselves. So we're lucky to have a government funded scheme that allows each ostomate to get the amount of product that they need. You can get more supplies if you need them for a medical condition, and this needs to be prescribed by your stomal therapy nurse. So the reason that the stomal therapy nurse is the one that arranges the products means that they can stay in contact with you, and if you have changes in your stoma or changes in the amount of product or what product you need, they can constantly review and advise on the best way to proceed. So thank you for listening to me today, and if you have any other questions, there is a huge amount of information online. As I mentioned, all the ostomy companies have amazing websites with a huge amount of information on them. We do also have an app which is called the Salts Trainer app and can be downloaded on the Google Play or the App Store. This has a bunch of videos and frequently asked questions in it that can be quite handy if you haven't, had someone with a stoma in a long time or you need that refresher in your pocket. You can contact the ostomate stomal therapy nurse, and you can always contact the ostomy company customer care services, and they have free call lines in Australia and New Zealand. So thanks for listening.